that are positive and testing positive in Maricopa County, we're starting to see an increase in the number of individuals that are requiring hospitalization once again around it. As we noted, here within Valleywise Health, we had, consolidated earlier this summer down into one unit where we were able to care for our patients that required hospitalization for COVID-19 disease. Over the last week and a half, we've had to reopen, so we're now operating 2 separate COVID-19 units to be able to accommodate the increased number of patients that are presenting to us that require hospitalization. We have noticed a significant trend that this is a group and a population that has been largely unvaccinated from that. Those folks that have chosen, for whatever reason, not to receive the vaccine are the ones that are being predominantly affected with these severe, signs and symptoms that are requiring them to need hospitalization. We continue to see this being a patient population that is skewing younger, the under 50 population for the most part of our average age of individuals that are being hospitalized with these severe signs and symptoms and needing treatment for COVID-19 disease. We continue to advocate that we need to make certain that vaccine continues to be available. It's available at multiple locations across the state of Arizona, especially here within Maricopa County. And those that have chosen not to do, we really need to encourage to continue that. This is now something that's available that we didn't see earlier this year when we had our large spikes in January from that. Even though vaccine has been demonstrated, those folks could still get this new Delta variant. We aren't seeing those individuals that have been vaccinated requiring hospitalization, for severe illness. So therefore, the risks really of waiting out to not get the vaccine, waiting out not to get the vaccine because the risk of the virus is so small really doesn't play out there. The side effects of the vaccine really minimal, but the benefits here are huge around preventing that severe illness around that. Additionally, this new Delta variant we know is more infectious and more contagious. Almost 2.5 times more infectious than what we saw from the original strains that we were dealing with earlier this year. Therefore, I encourage individuals as you're out and about outside of your immediate family unit, if you're going to be in enclosed spaces with others, no matter their vaccination status, it's prudent to wear a mask. Because remember, that mask really isn't protecting you, but it's protecting others from you if you're asymptomatically, having this virus, even though you may have been vaccinated. So we continue to advocate. We need to continue to advocate vaccine, masking in these situations so we can get a hold of this and continue and hopefully control the spread of this virus so we don't see this continued growth in the number of patients that are testing positive from this. We do not want to see, things that we saw earlier this year from that. With that, I'm going to set up the side and I'm going to let Martha translate, and then I'll come back and be happy to answer some questions. Thank you, everyone.
Thank you, Dr. Buenos días a todos. Queremos agradecerles el estar aquí el día de hoy, acompañándonos nuevamente para dar este. Bueno, estamos aquí primeramente para dar una actualización. Hemos visto un aumento tremendo en pacientes que requieren hospitalizaciones. El verano pasado teníamos solamente una unidad de cuidado intensivo para tratar a pacientes con COVID o una unidad de COVID. Ahora tuvimos que hacer otra reapertura en otra de las unidades para acomodar a todos los pacientes que requieren hospitalización. Lo que hemos visto es que continuamos viendo pacientes jóvenes, menores de 50 años, ¿verdad? Y hemos visto también que la mayoría de ellos son pacientes que decidieron no vacunarse por alguna razón y donde los síntomas son más severos. Hemos visto también que hay pacientes que se vacunaron y aún así les dio el virus, pero han sido pacientes que no han requerido hospitalizaciones. Recordamos y seguimos reforzando a toda la comunidad el uso o el vacunarse. Hay vacunas disponibles en todo el estado de Arizona, sobre todo aquí en el condado Maricopa, ¿verdad? Queremos también avisar que los vacunados, incluso personas que se han vacunado, pueden incluso llegar a infectarse, pero hemos visto que estos pacientes, lo vuelvo a repetir, no han requerido ninguna hospitalización. Hemos visto que los efectos de la vacuna son mínimos comparados a los beneficios que les da la vacuna, ya que sobrepasan los beneficios que los riesgos. Sabemos que esta cepa es mucho más contagiosa, ¿verdad? Y estamos diciéndole a las personas que si están en espacios cerrados, es prudente que usen la mascarilla para proteger a los demás. No solo para protegerse ustedes, pero para proteger a los demás. Así es de que seguimos hablando sobre la importancia de la vacuna, la importancia del uso de mascarillas para controlar la propagación de este virus y no regresar a como estábamos anteriormente.
Thank you, Martha. We'll go ahead and I'll be happy to answer some questions. I see some hands up, so I'll just start now as they're popping up on my screen. Brittany, if you want to start.
Hi. So I saw this morning that President Biden wants to require all outside U.S. travelers to be vaccinated. We get so many snowbirds and tourists here in the Valley. So what are your thoughts on that?
Certainly, we know that vaccine is an effective treatment and those that prevent the severe illness and hospitalizations for COVID-19 in a vast majority of folks that receive vaccine. I think having the ability to have individuals that are traveling within the United States and to the United States be vaccinated really helps us be able to help contain the virus, be able to make sure that those that come aren't severely affected with this illness and help us prevent the spread of this going forward.
In hospitals, are you seeing many of the patients with these severe symptoms? Are you seeing that they're tourists or mostly local people here?
So far, I'll say within Valleywise Health, the vast majority of patients that we have seen here within our organization have been residents of Maricopa County.
Okay, thank you.
You're welcome. Brian?
Hi, Doctor. Thank you. If you don't mind, a quick two-parter. For people who have the antibodies, do they still need a vaccine? Would you request or suggest that? And for the variants, do we know the future? Are they going to continue to mutate, circle the globe? And will this be a situation kind of like the flu where we maybe need inoculation?
Two very good questions, Brian, as we've seen this. The first part of that question around that, so any individual that has been exposed to the virus, contracted the virus naturally, will develop natural antibodies to that. That's how your body fights infection. But we don't know exactly how long those antibodies persist. So we are recommending, as part of the CDC recommendations, even those individuals that have had COVID-19 disease that may have antibodies do benefit from receiving vaccination. So previous infection with COVID, even though you may still have antibodies as you test the blood, that should not be a reason not to get vaccinated, because we know that may give you more durable protection against getting severe illness in the future. Your second question around variants here is also an important question. Will this virus continue to mutate? This is what happens with viruses. Viruses can change over time and mutate. It is likely the longer this virus persists within the human bodies and within our world and society, we are likely going to continue to see mutations from this. Changes over time. We'll just have to see as things go. Stuff that popped up was Peter.
Hello, doctor. Can you hear me okay?
I can. Thank you.
Thank you, Dr. White. So how long do you, I know we probably don't like to prognosticate, but how long do you anticipate this surge will last with the Delta variant?
Certainly with the Delta variant that we've seen in other parts of the world, the peak has been quite rapid and then again comes down relatively fast. Well, I don't think we've quite seen the peak that we may see as we continue to see the percent positivity increase certainly here within Arizona and across the United States. I am hopeful that we will see, much like they saw in England, the Delta variant peak very quick and then come back down very quick. But this is likely something that will extend, in through the month of September and maybe out to October. It's hard for us to see until we start to see that peak how long this may last.
So it seems like that you're monitoring the situation in the UK, maybe things that could wash up shore, so to speak, the trends that could follow here.
Correct. And that's, as we've seen the data being shared across the world, where they saw this variant before we saw it in the United States, we're hopeful that, we're able to see similar trends from that to kind of help us predict where we may be.
And do you think that things could calm down, the surge could calm down when the weather gets cooler here in Maricopa County and perhaps more people can go outdoors and transmit the virus or variant less?
No, and that's a great question that I don't think we fully understand and have the answer to, only because, even in the last fall, summer, and winter, we didn't see that. We saw that the cases actually went up, in that December, January time where it was cooler. More people were outside around that, yet we still saw that increase in the cases. So I think that the temperature variation to this is probably not as good or as likely of a benefit as we may hope.
And then maybe that's why, as you said, in the winter, the cases spike because people were gathered together. So I guess the factor here is the crowd sizes and the intimacy and the people being as close together as possible, around dinner tables and so forth. Maybe that's what we need to focus on.
Well, and again, this is part of the reason that we're recommending as people are inside, as you may be in close contact, even though you may be vaccinated, it's important that we continue to do the things that we saw earlier within this pandemic around being able to wear a mask, make sure we're keeping our hands clean around that, especially around others that you aren't living with, to decrease the chance of transmitting this virus from that.
Thank you.
You're welcome. We'll go Josh and then to Emily after Josh.
Hey, good morning, Dr. White. Couple questions. First, concerning numbers when it comes to younger people getting sick, and we do have a lot of kids going back to school. Can you talk a little bit about what you're seeing inside Valleywise right now with that younger population that have come in with COVID?
Certainly throughout the pandemic, we have seen children that have been affected and tested positive for COVID-19 disease that have required hospitalization throughout this entire time through this. Certainly with this more, infectious variant, we may see that increase as they've seen in other parts of the country of children needing to be hospitalized for these symptoms of COVID-19 disease. We have not seen a marked increase in the number of children that have required hospitalizations here within Valleywise Health. It's been fairly consistent for us as about 1% to 2% of the hospitalizations throughout this pandemic of COVID-19 have been in that pediatric population from that.
Now you're seeing a younger patient, 50 and younger. So what's the makeup of the patients that you're seeing right now? Being that they're predominantly unvaccinated, how is Delta impacting them? In ways that how is it? What does it look like now compared to what you saw earlier?
So certainly, other than the age, the virus itself is looking very similar to what we saw, in the winter and the last summer months. I mean, people are presenting with those similar symptoms of, the fever, shortness of breath, and we're seeing that they're not getting enough oxygen, just like we saw the last time. What is different this time is it's in that group that has not been vaccinated, which is in that group that isn't that under 50 group. A lot of folks have chosen for whatever reason not to get vaccinated. And those are the predominant folks that we're seeing today in the hospital.
And any update on Valleywise requiring staff to be vaccinated?
That message will be coming shortly around that, but certainly we applaud all of the other organizations that have gone, down that route. Certainly something that, we continue to evaluate and we'll likely move similar directions here shortly.
Thank you. Appreciate it.
Emily?
Hi, Dr. White. You mentioned earlier that Valleywise has now opened up 2 separate COVID-19 units. I'm wondering how many patients does each unit hold approximately?
The one unit holds 12. The other unit can hold 28. I'm doing the math in my head real fast. I apologize. So from there. The 12-bed unit is full now, and then part of the upper floor is also full. Not full, but has patients in it.
And for patients that you're seeing in the COVID units, are those like severe cases? Like, what's the ventilator usage like in those units?
Yeah, so that's a wonderful question. Today, of the 25 patients that we have in the hospital today, I have just 7 patients today that are on the ventilator from that. So it's a fair percentage that are on the ventilator here today.
So you guys, I know, correct me if I'm wrong, but in the COVID-19 units, you guys are reaching capacity. Are you guys anticipating opening any more COVID units? Is it becoming a big problem? In regards to resources, sorry.
No, that's a great question. I appreciate you asking that question. Certainly, we do not want to open any additional COVID-19 units at all from this, because that means that we're able to get in front of this. We're able to treat this better as we go forward from this. If we have to open additional space to care for these patients, we will, of course, do that. But that's going to negatively impact our ability to deliver care and other things, much like we saw earlier in the years, in January and then last summer as well around that. It affects the entire rest of the hospital operations when you do that. Our goal is to get in front of this and hopefully not have to expand this any further. With that, I'm going to step. You're welcome. I'm going to step and let Martha, translate the questions that you've all asked very well, and then I will be back for any final questions. Thank you.
Bueno, pues regresando un resumen de las buenas preguntas que se le estuvieron haciendo al doctor White. Una de ellas era de que el presidente Biden había ofrecido o había dicho que las personas que viajan de fuera o están fuera deberían de ser vacunadas. Si le preguntan al doctor sobre la opinión, bueno, ciertamente, como dice el doctor, la vacuna es el tratamiento más efectivo porque es el que está previniendo las hospitalizaciones. Nos ayudaría mucho, ¿verdad?, que esas personas se vacunaran, ya que nos ayudarían a contener el virus en sí. Preguntaban también sobre si la mayoría de los pacientes que estamos viendo son personas turistas o son locales. Bueno, dentro de lo que es Valleywise, nosotros, la mayoría de los pacientes son personas que han sido residentes del condado de Maricopa, del condado de Maricopa. Preguntaban también sobre si las personas que ya tienen anticuerpos deberían de vacunarse. Bueno, cuando nos da o cuando a una persona, por ejemplo, le dio el COVID, obviamente va a formar anticuerpos en su cuerpo. ¿Y qué es lo que pasa? ¿Verdad? Y esto es en cualquier persona que se haya contagiado. Bueno, lo que pasa es de que no sabemos en realidad hasta qué momento estos anticuerpos van a permanecer en su cuerpo. Por eso es importante que se vacunen, porque esto los va a ayudar a protegerse. En cuanto a las mutaciones, bueno, pueden cambiar, ¿verdad? Como lo vimos anteriormente del año pasado aquí, cambió y ahora pues pueden cambiar ya una vez que están en el cuerpo, puede haber más mutantes, como esta que hubo de la variante Delta. En cuanto al resurgimiento, hablaban sobre el resurgimiento que ahora hay con esto de Delta, ¿cómo lo veíamos aquí? Bueno, esperamos nosotros que nos pase como pasó en Inglaterra, ¿verdad? Donde el aumento se vio que subió rápidamente, pero que también bajó muy rápido. Aún creemos que nosotros no hemos visto el pico de esto, ¿verdad? De ahora de esta variante, quizá en septiembre, octubre, y nuevamente, ¿verdad? Esperamos de que aquí veamos lo mismo, de que si sube, como sube rápidamente, también así vaya a bajar. Hablaban también sobre si las temperaturas tenían algo que ver con el virus. Bueno, no hemos visto que las temperaturas sean un factor en el aumento de casos. Si ustedes recuerdan anteriormente, el virus subió durante la temporada donde ya las temperaturas habían bajado. ¿Por qué? Bueno, pues probablemente porque estaba más gente adentro o porque la gente empezó a salir más. Entonces, por eso seguimos recomendando el uso de mascarillas para disminuir los casos. Preguntaban también sobre la población joven. Bueno, nosotros aquí dentro de Valleywise no hemos visto incremento en niños. Sí sabemos que durante la pandemia anteriormente fue el 1 o 2%, fue una población pediátrica que tuvimos durante esto. Pacientes actuales, los pacientes actuales sabemos que predominantemente no están vacunados. Sabemos que los síntomas de la variante Delta son muy similares al COVID-19, como lo vimos anteriormente. Entonces, por eso es de que estamos viendo el hecho solamente es de que los predominantemente no fueron vacunados, perdón. Seguimos evaluando el requerimiento para ver si es necesario que todos los empleados aquí se requiera que todos se mande, que sea mandatorio la vacuna para todos los empleados. Ese anuncio se va a dar más después. Unidades COVID, ¿cuántas tenemos? Bueno, tenemos ahorita 2 unidades abiertas, como lo mencionamos, tuvimos que volver a abrir otra unidad. 12 pacientes están en una unidad, 28 en otra unidad, las camas. 12 pacientes tenemos en una unidad, en la otra unidad son 28 camas. Y tenemos pacientes en esta otra unidad. El día de hoy, Valleywise tiene 25 pacientes, 7 de estos pacientes puestos con ventilador, está respirando por un ventilador. No queremos abrir, obviamente, unidades adicionales, pero si tendremos que hacerlo, pues lo vamos a hacer. Y porque esto afecta también el servicio a otros servicios de atención de salud que pudiéramos dar.
Thank you, Martha. Any final questions at all for me this morning? Terry?
Hi, good morning. Thanks for having this. I was wondering, Dr. White, I don't know if you can quantify this, but what metrics would you have to reach for you guys to cancel elective surgeries?
Terry, I think that's a wonderful question. And we're going to do everything in our power not to have to curtail any elective procedures within Valleywise Health. But certainly, what would require us to do so is if we do not have, the ability to adequately care for patients in that post-operative period, i.e. we have to, move folks that would usually be in our operating rooms and our PACU to the bedside from that. So we watch this on a daily basis. We have not reached that point at this point where we're having to say, we have to stop doing all elective procedures. But if we start to see a marked increase where we're having to open multiple additional units within the hospital, we may move to that direction.
Thank you.
Well, again, I want to just thank everyone for joining us this morning and continuing to provide the information, within our community around COVID-19 disease and the Delta variant, the importance that, we have resources available now through vaccine that can help prevent severe illness and hospitalizations, and certainly would encourage folks as they're inside and around others in those indoor environments to wear their masks. So thank you very much. I'll let Martha kind of close us out and we'll talk again soon. Thank you, everyone.
Bueno, gracias. Vamos a la pregunta final. La pregunta final era ¿qué medidas vamos a tomar o si hemos llegado al momento donde tendremos que decidir? Hasta este momento se está revisando diario, no hemos llegado a ese punto. Cuando nosotros veamos que ya no podemos atender a los pacientes debido a alguna cirugía electiva, y no le podemos dar la atención adecuada, entonces estaremos tomando ya medidas en cuanto a esto. Si se deben de abrir más unidades de COVID, bueno, pues obviamente sí, quizá lleguemos a ese punto donde se cancelen todas las cirugías o procedimientos electivos. Y bueno, queremos agradecerles, recordarle al público, hay recursos disponibles, está la vacuna y también si van a estar dentro de un ambiente cerrado, sigan usando la mascarilla. Eso es importante. Gracias.
And thank you again, everyone, for attending. We'll be sending out a Dropbox links to this video shortly. Thanks.